Welcome to a closer look. Unfortunately, fentanyl overdose deaths continue to rise in our country and in our city. Here to tell us about an initiative aimed at reducing overdoses is Danielle Collins-Facto, Licensed Program Supervisor with Chesapeake Integrated Behavioral Health Care. Welcome to the show.
Thanks for having me.
What is harm reduction?
Simply put, harm reduction is any strategy or behavior that reduces a person's harm or risks to themselves or others. So some common examples would be seatbelts, car seats, vaccines, sunscreen. Ultimately, those strategies save lives.
So what strategy is available for someone who may have an addiction?
Yeah, that's a great question. So medication-assisted treatment is a common resource available to individuals who are experiencing substance use disorder. So commonly we would think about methadone or Suboxone or Vivitrol, which are prescribed for individuals who experience an opioid use disorder.
Okay, so can you share some of the statewide impact of opioid deaths?
Yeah, it's pretty huge. So since 2013, fatal drug overdose has been the leading unnatural cause of death in the state of Virginia. So that's about 10 years. For 10 years, our state has been experiencing that. And not only are we concerned about the loss of human life, but in 2017, which is the recent data that we have, the state lost $1.5 billion, loss of productivity due to opioid overdose deaths, incarceration, and substance use disorders. So the state is really feeling it.
And the city, numbers have risen in the city as well, in Chesapeake?
Yes, so I did also want to share that statewide in 2021, 76.5% of the opioid overdose deaths were caused by fentanyl. And that was a 15% increase from the year prior. And what we're seeing here locally is from 2019 to 20, we saw a 50% increase in fentanyl deaths. And the 2021 data, while incomplete, is trending upwards to 2020. So our community is being impacted by fentanyl.
And what exactly is fentanyl?
Fentanyl is a powerful synthetic opioid. When prescribed and used appropriately, it would be used for chronic pain that does not respond to other opioids, perhaps post-surgery. But what's happening is it's being manufactured illicitly, pressed to look like pills such as Vicodin or oxycodone, mixed with heroin, cocaine, marijuana, and people are unknowingly ingesting fentanyl and dying.
So that addiction to maybe a painkiller after a procedure, it may start as an addiction after you have a procedure and are prescribed something legally, and then you have that need to find something that may be more accessible. Is that what's happening?
That is happening, not as often as it was, say, 10 years ago.
Because physicians are being more careful?
Yes, there's been a lot of parameters put in place to reduce, to make an impact on the opioid epidemic. And so physicians, gained increased knowledge. There's the prescription monitoring program. There's functions like this, trying to educate the community.
Absolutely.
So it's more so that people who manufacture and sell drugs are looking for creative ways to increase the demand. And because fentanyl is more potent and could cause people to feel more high, this is the situation that we're in now.
Which is so unfortunate, so unfortunate.
It really is.
Because it changes the chemistry in your brain. Is that correct? Once you start taking something like that?
Yeah, so just like any substance that you take, any prescribed medication, even caffeine, nicotine, does change your brain chemistry and cause you to become dependent on it. Now, not everyone becomes dependent on prescribed medication.
Sure.
So there's a lot of variables that come into play.
So what is our community's need for the strategy of harm reduction?
Yeah, so what we're doing at CIBH is, in addition to medication-assisted treatment, Suboxone or Vivitrol, through our office-based addiction treatment program, We've also assembled 800 rescue bags.
And you brought one here today.
I did. And we're making these available to the community. Each bag contains fentanyl testing strips, Narcan, and just to share a little bit of information about Narcan, Narcan is an opioid overdose prevention strategy. So we use the nasal spray, and what it does is it knocks the opioid receptors off the person's brain and prevents them from overdosing. So we thought it was extremely important for us to make this available to the community.
And you've had training on that, how
Yes.
to administer that.
Yes, and each bag contains an instruction card on how to use both the fentanyl testing strips and the Narcan.
Okay.
The Narcan is very easy to use. If you've used a nose spray, you can use Narcan.
Okay.
We also include information about treatment because that's our hope. Our hope is to meet individuals where they are and plant seeds and opportunities, and treatment and recovery are possible for all people.
And that's the message
That
for
is the
people who may
message.
have lost hope that they can beat this, that
Yes.
there is hope.
Yeah, so we believe strongly that breaking down the stigma for addiction, harm reduction strategies such as high blood pressure medication or medication for high cholesterol, those are harm reduction strategies to save people's lives. And it's the same for substance use disorders.
And it is a disease.
It is. It's a brain disease. Your brain changes after having these substances in it for a certain period of time.
And there is help. And where can someone grab a bag like this or get help if they have an addiction or if they know someone who does?
Yeah, so I would encourage people to call our agency, which is 547-9334, and ask to speak with the same-day access team, and we will share information as to how they can obtain the rescue bags.
Okay.
We've also worked with several of our community partners, such as the health department, Buffalo Family and Friends. So we are making sure that we're making this available throughout all areas of the community, not only at CIBH.
Because there is a need throughout our whole city.
There is.
So that's so great to hear that you're partnering with both of those. They are great organizations.
Yes.
All right. Thanks so much, Danielle, for joining me today to
Thank
talk
you
about
for
this
having
important
me.
topic. Thank you. Well, that does it for this edition of A Closer Look. Be sure to join us next time.